Good afternoon, everyone. Thank you all for participating in today's webinar, Health Disparities, a conversation about minorities and donation in Central Illinois. My name is Terry Cagle, and I am a donation liaison at Gift of Hope Organ and Tissue Donor Network. Gift of Hope proudly serves as the federally designated non-for-profit organ procurement organizations, or better known as an OPO, that coordinates organ and tissue donation and services to families of donors in the northern three-quarters of Illinois and northwest Indiana. Before we get started on today's webinar, please know that this webinar is being recorded for rebroadcasting. A link will be sent after the broadcast is available on the Gift of Hope YouTube channel. We have muted all your mics to reduce background noise. All questions are welcome anytime during the presentation by typing them in the questions panel on your screen. Questions will be read to the presenters at the end of this presentation. If time does not allow for all questions, we will follow up with you via email. Your feedback is very important to us, and immediately following the webinar, you will receive an email with a survey link to provide feedback about today's webinar. Lastly, keep the conversation going by following Gift of Hope and the National Kidney Foundation of Illinois on the social media channels. We encourage you to like and share the post to help us build awareness about organ, eye, and tissue donation. Now we can begin. Our first speaker today is Jim McFarland. Jim is a kidney transplant recipient, and he is here to share his story.
And through the magic of technology, I think I'm here. Can everybody see me? I see me. Very well. I'm going to proceed as if you can. Good afternoon, everybody. My name is Jim McFarland. As Terry said, thank you very much for the introduction. Really happy to be with you today. I'm excited, happy to be invited by Gift of Hope to share my story. Without trying to be funny or sarcastic, at this stage of my life, considering where I've been and the journey I've traveled, I'm happy and excited to be anywhere. Because I got to tell you, as sure as I'm sitting here talking to you today, I know that by all rights, I should not be here today. I am living on borrowed time. And every day when my feet hit the floor, I say to myself, praise God, I've got another day. And I'm not sure why he's allowed me to stay around, but I think one of the reasons might be that I have a chance to be Exhibit A and talk to other people about the value, the need, and the importance of organ donation. You see, in the summer of 2009, I was diagnosed with stage 4 kidney failure. Now, if you're not familiar with the stages, at stage 5, they're talking to you about making your will and making arrangements. So stage 4 is kind of serious. But on November 28th, 2011, the day I called my second birthday, almost 2 years on dialysis, I received a life-saving kidney transplant at Barnes-Jewish Hospital in St. Louis, Missouri. Now, I know the name of today's discussion is Minorities and Donation in Central Illinois. So I almost feel like I'm cheating to be here. But we didn't necessarily opt for Missouri over Illinois because of the lack of organs in Illinois. After careful consideration, my wife and I decided we would get our treatment based in St. Louis rather than Chicago because it's easier to get in and out of St. Louis. It had a national reputation for organ transplantation at the time at Barnes Jewish. I believe it still does. And at least at the time, it was easier, cheaper. If my wife had to stay with me for several days, it was easier to be in St. Louis. It's a little cheaper, rooms are a little less expensive. But I'm still with you today due to an amazing circumstance. I'm walking around with the kidney of a 6-year-old girl, an African-American girl, who went to school one day, suffered a brain aneurysm while on the playground, and died right there. She did not make it home that day. Now, as many of you may know, in many cases, your exact organ match is not a member of your immediate or extended family and could be a complete stranger. In my case, that was true. This little child's kidney was a perfect match for me. Now, I'm certain the transplant nurses that day broke all kinds of HIPAA laws because they couldn't wait to tell me whose kidney I was getting. her story was on the news in St. Louis, so they were showing me online stories. Look, this is the person, this is the girl whose kidney you're getting. And let me tell you how amazing this is. You might be wondering something I was wondering. Over the course of a year, that tiny kidney grew in size within my body to accommodate my 6'3", 248-pound frame. Tell me God's not amazing. And while she's a teenager now, we call her Cheyenne. I named her after the child whose kidney was in her body. She's a teenager now. She still kicks up from time to time, but overall, she is functioning incredibly well, lo these almost 10 years later. In fact, many of my kidney function numbers are better now than they were before my kidneys started to fail. So I can't believe how happy I am today, how satisfied, how content, how relieved I am today because someone thought enough to donate an organ to me. Now, you might say in a cynical way, well, isn't it easier to donate somebody else's organ than donate your own? Well, I don't think so, because I've got to believe that Cheyenne's parents went through a lot of crushing shock and grief to make that decision. I thank God for them every day for having that courage, making that commitment to say, how can our child's life benefit other lives? So I'm really thankful that a month has been set aside this August to focus on organ donation among minorities, although I think it should be a year-round focus. And I understand it's hard to focus on other needs during this catastrophic year of 2020 when so many other things have changed and so many other issues are commanding our attention. But it's every bit as vital now as it ever has been. Because as you may know, currently in Illinois, there are 4,000 people waiting on the waiting list for a life-saving organ. And well over half, almost 64% of those people are people of color. That's not right. The operative word for this situation is disproportionate. We've heard a lot this year in terms of coronavirus, but it's also true in our situation because a disproportionate number of Black people are in need of transplanted organs as opposed to the number of organs available. It's a very simple equation. We need donated organs more than are people willing to donate organs. Now, studies have shown that even though organs like kidneys are interchangeable, for some reason they seem to function a little bit better and last a little bit longer when they're transplanted between people of the same race. So a disproportionate number of African Americans are susceptible to kidney disease and other serious maladies. I don't know why that is. I suspect, we could argue it's because we weren't supposed to be here in the first place, but that's a whole different historical argument. If history has taught us anything, though, it's that we cannot rely solely on other people to protect and take care of us. We have to do some things ourselves. Now, organs can be donated while you're living. The kidney, you can donate part of your pancreas, part of a lung, part of your liver, part of the intestine. But more important is to think about what's going to happen to your organs when you're gone. Now, I spent a little over 2 years as the ESRD, that's end-stage renal disease, ESRD representative, patient representative for this whole state of Illinois. Now, it was largely a ceremonial position because the state charter in Illinois demands they have a patient on that board. So they looked at me, but they didn't listen to me. I didn't care. It gave me a title. What the title allowed me to do was go across the state of Illinois and talk to kidney patients, people waiting for organ donation in dialysis centers across the state. I would go and say, I am the ESRD patient representative for the state of Illinois. I demand to speak to patients. They would go, oh, okay. So I would sit in the lobby and just talk to people as they came in. And what I found out was that a lot of people who are in need of a kidney have many of the same misgivings and second thoughts that people who think about donation may have. Let me dispel a few of those myths. Rich people, people with power or influence do not buy their way onto the list when it comes to getting a transplant. They receive no special treatment, no advantage. So it's all an equal playing field. Doctors and surgeons don't give up on trying to save you in the operating room because they want to harvest those good Black organs. That's not true. It's against their code of ethics. They will try to save you if they can, but if they can't, wouldn't it be great to use those organs to help save someone else's life? Every major religion supports organ donation. If you still want to have an open casket funeral, if you know that kind of thing, you can still do it after you donate organs. It's the ultimate gift, the ultimate in recycling. And I often tell people, I guarantee you, you will not need those organs after you're gone. Gift of Hope is a magnificent organization. They do great work. They can offer you great professional help and advice in the area of donation. and tell you how you can get involved with the National Minority Organ Donor Awareness Month campaign. It's so great that it's here for us. It's so great that we have a chance to make a difference. If you've thought about it, but you're not sure, if you've never thought about it, but might be open to be convinced, I'm just here, like I said, I think I'm here as Exhibit A to let you know that it can and does make a difference. I was so proud, I was recently awarded a Distinguished Alumni Award at the college I graduated from, a little bitty college called Hope College in Holland, Michigan. It's a very rare honor. They don't give it out but once or twice a year. I got one for 2019, and I couldn't help but tell the people at that acceptance speech, I would not be here to accept this great honor. It's great when your alma mater thinks that you did something worthy in your life to be awarded as a significant alumnus of the college. I just want to thank them. I wouldn't be here if Cheyenne's family had said, let's donate her organs and see if someone else can be saved from it. So you don't know what your life's going to hold. You don't know what's going to come up, but it's great to be around to witness it and see it. I want to thank you for spending the time listening to me ramble on, but if you take anything away from what I've just said, listen to this. Gift of Hope does great work, and they would love to help you consider organ donation. See, get involved this month, National Minority Organ Donor Awareness Month. Do what you can and think about saving lives. Thanks a lot.
Thank you, Jim, for sharing your story. And we appreciate hearing from you and the process that you had gone through and how you're supporting everyone throughout that decision process. Our next speaker is Marian Schnook, Director of Family Services and Community Affairs, Gift of Hope, to talk about why health disparities exist. Marian?
Thank you, Terry. And Jim, thank you so much for your story. Yes, today I'm here to talk about National Minority Donor Awareness Month. About 30 years ago, National Minority Donor Awareness Day and Week was created by the MOTEP Foundation to honor the contributions of African American families and minority families to the organ and tissue donation process. A long time ago, people thought, and some even think today, that minorities don't donate. They won't donate. And it's not that they won't donate and they don't donate. It is that we haven't framed the conversation in a way that helps them understand the process of donation. And so with that, National Minority Donor Awareness Day was created to really honor those contributions. And so segue to now today, we talk about it as National Minority Donor Awareness Month because it now encapsulates all of the different minorities, African American, Hispanic American, Asian American, Latinx population, the Muslim population, LGBTQIA population. And so what that means is that we have a very diverse set of minorities that can and will donate. So we want to make sure that we honor all of those contributions and ensure that they're getting the recognition for being selfless in donating and helping to honor the legacy of their loved ones. And so Jim mentioned earlier about disparities. Why do disparities exist in minority communities, specifically African American, Hispanic, and Latinx community? Well, as he mentioned earlier, it is because of sometimes it's lifestyle, sometimes it's what we eat, it's sometimes that we have a healthy mistrust of the healthcare community. And let's face it, some of them are founded, and so they have mistrust. When you take a look at those myths and misconceptions also that minority communities have, it's a little bit difficult to then frame a conversation that would help them understand the process. And so as we take a look at this list, you will see on your screen, there are about 110,000 Americans waiting. And I didn't say minorities, I just said American. But if you take a look at that, over 80% of those who are waiting for a life-saving organ are waiting for a kidney transplant. And that most disproportionately affects communities of color. And so when you take a look at that, my next slide, please. And when you take a look at that, you look at that minority patients make up 65% of those waiting for a kidney transplant. So that's a very difficult situation to be in. And so Jim asked you all earlier, why is it that minorities don't donate? Why do these health disparities exist? And what would make this list go down? Well, it's very apparent. One, we need everybody to register. We need people to say yes to donation. We want people to start the conversation with their loved ones about donation. Second, we would ask people to come to Gift of Hope and find out the truth about organ and tissue donation. Find out how we save lives, enhance lives, and how we create lasting legacies. And then what we'd also would ask is that minority patients really talk about a couple of things. Monica Fox will be here shortly to talk about living donation. Donation is donation. We can all donate to everyone. But the question Jim asked is, why is it important for communities of color to donate to each other? Well, it's important because when you have people who are the same ethnicity, sometimes it helps so that there is not a higher chance of rejection. So when you have people of the same ethnicity, it helps to keep down the rejection. And so we want to make sure that patients are receiving the best care that they can, and that they're receiving the best organ possible that they can get. And so when we take a look at this list, kidney disease, the main failures for people of color when it comes to kidney disease are hypertension, diabetes, high cholesterol, and all the symptoms that go along with that, and symptoms that are, oftentimes silent. And so with being silent, patients often don't know until it's too late. And then second of all, we don't go to the doctor until it's too late. And I will tell you, I have a brother who is currently on dialysis, but he had undiagnosed hypertension for 20 years. And now being a male, he didn't go to the doctor. So that's part of the problem, that one, he didn't go to the doctor. Two, his diagnosis was undiagnosed. And even though I work in healthcare, even though I've been at Gift of Hope for 11 years, sometimes families just have a mistrust, and my brother had a mistrust of the doctor. So that's why he didn't go until it was too late and he started feeling some symptoms that were closer to end-stage renal failure. And so now he is on the list waiting for an organ, and my twin sister and I will probably be a living donor for him. But it's very important that, we start having these conversations and that we don't fall into the trap of, misconceptions, that we believe that we can't have a funeral, that they're going to take our organs, as Jim mentioned earlier. Gift of Hope is one of 58 organ procurement organizations, and so you can go anywhere and have a conversation and learn about what can happen. So as we honor National Minority Donor Awareness Month, these are the things that we're going to ask you to do. We have a toolkit. It is in English and it is in Spanish that can help you learn about National Minority Donor Awareness Month. We also have a Say Yes campaign that works alongside National Minority Donor Awareness Month to help teenagers and college students learn about organ and tissue donation. We also have a 16, 17-year-old program that we want people to really start having the conversations, because as Jim mentioned, you're never too young to experience a tragedy. And so we want to be able to create that lasting legacy for people to really understand that this waiting list is real. 65% of people are waiting for a kidney are minorities. And so we really want to have a conversation in all those communities to talk about how we can help. And so to Jim's point, you just don't want someone else to help you. If you had an opportunity to save someone else's life, would you? And 99.9% of the time, the answer would be yes. So having the conversation about organ and tissue donation is something that has to happen, not just when there's a tragic circumstance, not when there's a funeral, but all the time, every day, Sunday dinners, at weddings, at picnics, at barbecues, at schools, at church. And so that's what Gift of Hope does. We do a lot with community outreach to talk about how we start these conversations. And so we just ask you, as our listening audience, to really take this message and the messages that you will hear today back and start those conversations. Say yes to donation and really make a difference. And if you are a member of an ethnic minority community, we ask that you call Gift of Hope if you have questions, and more importantly, please find out the truth for yourself and for your family, because we all talk about the one thing that's going to happen. We don't talk about the one thing that's going to happen to all of us, and that is death. But we do make plans for everything else. We make plans for what we're going to do after COVID. We make plans for the vacations we're going to have. And so I ask you to make plans for this. I know it's distasteful. I know people don't like talking about it, but really, if you could save someone else's life, would you? So thank you so much. And please feel free to call us, call Gift of Hope. We have amazing staff that's here to answer your questions, but more importantly, to work with you in the community, in your workplace, and in your schools to have a conversation about donation. Thank you so much.
Thank you, Marian. And it's just a reminder to all the attendees, that if you have any questions, type in the question box and we will answer at the end of the presentation. Next speaker is Michelle Reif, and Michelle is the regional manager for the hospital development at Gift of Hope, and she is here to talk about donation numbers.
Thanks, Terry. And thanks, Marian. So yes, if you want to go ahead to the next slide, please. My name is Michelle. I work for Gift of Hope in the downstate Central Illinois satellite area. And so Marian talked a little bit about registering and how important to register that decision is. So I thought it might be beneficial to talk about what does that really mean. And so on this slide is just a little bit of information on the donor registries. And you'll see at the bottom, sometimes we get questions about how do I know if I'm registered? And so I have a picture of a driver's license below, and in Illinois, it's the state of Illinois in red with the donor on it. So if you have registered, that will be on your driver's license. And the simplest way to do that is when you go get a driver's license, a state ID, you can just Google, how do I register? And several sites will come up. But I think it's important to know that if somebody comes into the hospital due to an injury or illness, nobody really knows if you're a registered donor. The hospital's obligation and what they do is try everything they can to save the life of that patient. It's only when there's a non-survivable injury or illness that Gift of Hope is contacted. So we'll talk a little bit about that. If you want to go to the next slide, please. So it's asked to talk a little bit about the numbers. And since this is focusing on the downstate Central Illinois area, I took the liberty to pull out the data from 3 of the large counties, Champaign County, Peoria County, and Sangamon County. And so what you see in the first graph to my left, maybe your right, is the registration rate. And this is what the Secretary of State looks at when they look at registration. So if you, on the previous slide, if you're a registered donor, it'll say for purple is Champaign County. So 55% of Champaign County has actually registered the decision that they would like to be an organ, tissue, and eye donor in the unfortunate event that something happens to them and brings them into the hospital for a non-survivable injury or illness. You'll see followed by Peoria in green and then Sangamon County in blue. The second set of graphs talks about, it's the overall authorization rate. So that is all races, all ethnicities. And again, it's for the different counties. So you'll see that compared to the registration rate by county, we see at Gift of Hope a slightly higher authorization rate when we talk to families about donation, whether the loved one's already previously designated that they want to be a donor, and that's called their first person authorization, or if the family makes that decision for them to be a donor. When we separate out what the minority registrations are, so the middle graphs, you'll see some lower rates, 30%, 28%, and 26% respectively. And these numbers represent, so any patient that meets certain criteria that comes into the hospital. So let's say you go to the hospital, you walk around the ICU, and all of those patients, they're on a ventilator. And if you asked, well, you couldn't ask them, but if you found out each one if they were registered donors, you would see that in the minority population, 30% of Champaign County would be registered, 28% in Peoria, and 26% in Sangamon County. So what we're trying to achieve is to really increase those numbers. We really want to talk about the myths, the misconceptions, and it's extremely important because as Jim talked about previously, he would not be here without that gift of donation. So the last two set of graphs that I wanted to share with you is really about authorization rate. So when our Gift of Hope team is called by the hospitals to talk to families about donation, this is what we typically see in these counties. So you'll see when we talk to families, 69% say yes in the African American community to donation in Champaign, 35.7% in Peoria, and 80% in Sangamon County. And the next set of graphs is the Hispanic authorization. So why is this important? Can you go to the next slide, please? It's important because, and Marion and Jim already did speak to this, but they think they had statistics around 64% of the entire wait list in Illinois being African Americans. In the central Illinois, it's about 57%. And so African Americans hold about 40% of the Illinois kidney waiting list. And it's not just anyone can receive a gift of a life-saving organ transplant from race, sex, gender. It really doesn't matter. But what really matters and why this is a really important topic to speak on is because there's compatible blood types and tissue markers when we're trying to match a donor to a recipient patient. So Jim mentioned Cheyenne was a really good match, and that's typically probably because they have the same ethnicity, some of the same blood typing and tissue markers. And that really speaks to the outcome, the positive outcome that Jim and others that receive that gift from like ethnic groups, that really has a positive impact. And so in order to really increase the number of recipients in the minority communities to receive that gift, we have to increase the number of families that say yes and the number of families and ethnic groups that register to be donors. Next slide, please. So I just want to take a minute, and if you can just envision with me. Envision a time when everybody said yes to organ and tissue donation, that they've had these conversations, that webinars like ours have really made an impact. They have these conversations in their churches, in their schools, at home, at dinner time, like Marion talked about. If everybody said yes to donation, this is what we would see in Central Illinois alone in 1 year. And in 1 year, we would impact 1,000 more families by giving them a different legacy for their loved one. They would have donation to hold on to. We would have 161 more gifts of an organ transplant. So think about that for a second. If everyone said yes to donation last year in downstate Illinois, 161 more organs would be available for transplant. And we know that about 1/3 of those organs that's transplanted by Gift of Hope go to African Americans. And so that's about 54 more African American patients that would receive the gifts of an organ transplant. So 54 more gems. And who wouldn't want 54 more energetic, full of life people like Jim to be able to receive that gift? And so that would be just a phenomenal impact for him, for everyone he touches. And then you think about tissue donation. Tissue donation is an amazing opportunity for those in need. You think about the burn victims. You think about patients that have cancer of the bone that can have a transplant. And so we would have 5,000, a little over 5,000 more tissue transplants available if everybody said yes to donation. So I think infinite lives would be impacted, I think that's really why we want to talk through National Minority Donor Awareness Month and really start the conversation. So next slide, please. So this is really what we're asking you to do. I mean, we have a great opportunity to foster change right now. We're full of conversations about COVID and social unrest and the disparities, disparities is a topic that we're talking about today. So how do we change that? I think we have the ability to have these conversations. So if you start those conversations today, if you can inspire one person to have this conversation with you, ask them to talk to somebody else, and then ask them to talk to their neighbor, I think that we would be able to increase that donor registration rate, increase the number of life-saving gifts available for transplant. Marion talked a little bit about disease prevention, and I think Monica is going to talk a little bit more about that as well. But if we have more education on this topic, again, I think we can prevent some of these recipients on the wait list for so long. And then the last call to action really that I would ask you is to say yes to donation. Marion mentioned the Say Yes campaign. And if you register today, I think that you are doing one of the most easiest things you can do by just registering to say yes. Oftentimes we hear nobody wants my organs, or I'm too old to donate, but there are amazing technologies and improvements going on, and I would just encourage you to say yes, and you might have the ability to donate if in the event that something happens to you. So I appreciate the time today. I think this is a really inspirational topic. We have the ability to change lives every day. I'm blessed and grateful to be working for Gift of Hope and working with these colleagues. And I do hope that you take some time to consider at least what is best for you and educate yourself on this topic, and make those gifts more available for our minority communities. So thank you very much.
Thank you, Michelle. Our next speaker is Monica Fox, and she is the Director of Outreach and Government Relations, National Kidney Foundation of Illinois. Monica?
Thank you. I am so honored to participate on this in this conversation today, because all of this is very personal to me. Like Jim, I'm also a transplant recipient. I received deceased donor kidney in 2016 from my hero, Milton. Milton was a 53-year-old man who saved 3 lives through organ donation and enhanced many others through eye and tissue donation. Milton had shared with his family his wishes and that he knew he could save many lives, and that he did. My story began when I was suddenly diagnosed with kidney disease and urgently put on dialysis. Although I had spent 25 years working as a medical administrator, I had no firsthand knowledge of kidney failure, dialysis, or the weight associated with receiving an organ. So I spent my spare time while I was on dialysis volunteering for Gift of Hope and the National Kidney Foundation, learning as much as I could about organ donation, dialysis, and kidney donation. Now my job is to educate others about kidney disease and advocate for policies to help improve the lives of kidney recipients, patients, and living donors. So let's talk about kidney disease. Next slide, please. Over 37 million American adults have some level of kidney disease. Jim indicated he had stage 4 kidney diseases in stages of 1 through 5. And about 90% are unaware. Many people don't realize that the leading causes of kidney disease are uncontrolled diabetes and high blood pressure, and that kidney disease is the 8th leading cause of death in Illinois and the 9th leading cause of death in the United States. Next slide, please. Black Americans are 4 times more likely to develop kidney disease than white Americans, and although Black Americans make up only 13% of the American population, they make up 35% of all people with kidney failure. A couple of reasons why is because we're 2 times more likely to have diabetes, and almost half of us have high blood pressure. Unfortunately, many people don't realize that high blood pressure and diabetes are the leading causes of kidney failure. So we're committed to sharing that message at NKFI. We're committed to sharing that message with the Black community. Next slide, please. Latinx adults are 1.5 times more likely than white Americans to have kidney failure. And the numbers are growing due to the fact that they are almost twice as likely to have diabetes. In fact, 1 in 4 Latinx people over the age of 45 are diabetic and have high blood pressure. That's why we work very hard to spread the word in Latinx communities that diabetes and high blood pressure are the leading causes of kidney failure. We have an outstanding outreach professional who really creates and develops partnerships. And we are looking to enhance those partnerships down in Central Illinois as well, to continue our outreach and education. Next slide, please. So dialysis is a life-saving treatment, and patients have options about treatment modalities. They can choose in-center hemodialysis, home hemodialysis, or peritoneal dialysis, which is also done at home. And at NKFI, we empower patients by helping them to understand that they have choices. And through our educational programs, we expose them to the information to be able to make the choice that is best for their life. All of this is very important. You know, some people work throughout dialysis. I personally chose in-center hemo because I wasn't working and felt like that was best for me at that time. The other treatment option is transplant. And transplant is the treatment option that gives you the most freedom and flexibility. It allows you to live a normal life, not tethered to a machine. However, it is a new normal. It requires that you take your medication every day on time without fail. I have several alarms set on my phone and all around me so that I don't miss my medication, because that is the important treatment to keep my body from rejecting this precious gift that I received from Milton. Next slide, please. So here are the numbers regarding transplant. You already heard that over 4,000 people are waiting on organs, and well over 3,300 are waiting on kidneys. And of those 3,300 people, 2,000 of them are Black and Latinx Americans. So we've got a lot of work to do. We've got to get these numbers down. Of the 910 kidney transplants that were done in 2019, only 340 of them were living donors. And of those 340, 50 of them were Black and 66 were Latinx. Like I said, we've got a lot of work to do. So I'm going to talk just a little bit about living donation. We're all born with 2 kidneys, but we can live with 1. So healthy Americans can be tested and save the life of a loved one, a friend, or even a stranger through living donation. There are many altruistic living donors that just wake up one morning and say, what can I do? Let's see, I have 2 kidneys. I'll donate 1. And they donate 1 kidney to someone they don't even know, and that generally kicks off a whole chain reaction where people who are waiting that have donors that don't match with them are able to participate in this chain. So if you've never seen a story about a kidney chain, I encourage you to go look one up, because it's amazing. Here in Chicago, Northwestern has done some huge kidney exchange where many people, up to 7, 8 people, have received kidney transplants. I have a friend who was scheduled for a transplant, and his donor was a match for him. However, there was another pair within that hospital that they weren't a match. So the hospital approached them and asked if they would do a swap, because my friend's donor was a better match for the other patient, and the other patient's son was a match for my friend. And they participated in this swap. And these two families are connected now forever. It was awesome. It was a beautiful day. Next slide, please. So what are we doing at NKFI to help change things? How do we help? Prevention is the key, as was indicated earlier. Our number one goal is to prevent people from going into kidney failure. And if people are living with kidney disease, to help slow the progression of it. So we do, and the key is knowing your numbers, knowing that you are at risk, knowing that you have high blood pressure, knowing that you are diabetic or borderline diabetic. If people know this, then they can do something about it. How do we do this? Well, we do this with our Kidney Mobile. We go to communities throughout the entire state of Illinois doing free kidney screenings. And we usually start in March and go through November. However, COVID started in March, right? So we weren't able to start our kidney screenings. However, we do have our first one scheduled here in the South Suburban area of Chicago and Lansing on August 22nd, because we have revamped our screenings and we've added all the necessary guidelines and precautions for COVID-19. So we do many screenings in Central Illinois, and we're always looking for community partners to work with us and host them. Since nutrition plays a major part in preventing and slowing the progression of kidney disease, we also have a full-time dietitian on staff, Dr. Melissa Prest, who is available for consultations with patients, virtually, of course, right now. Education is the other key, and we generally do our educational programs in person, but we've pivoted and are offering them virtually now. So the beauty of that is that it allows us to reach the whole state of Illinois with all of our programming, not just some. Annually, we do one of our programs in Champaign and have an excellent turnout. However, now all of our programs are virtual, so everybody all over the state can access them in real time as they happen, and can also access the recordings. So we have professional and patient programs, and I'll list them here, but you can find more information about them on our website that you saw earlier, www.nkfi.org. So at NKFI, our National Minority Donor Awareness Month celebration is to premiere the first of our podcast series, which is the Journey Continues podcast, which will be available for download on all podcast platforms on August 18th, which also happens to be my birthday, just a side note. That podcast has been funded by the Donate Life Illinois Committee. You'll want to subscribe because we're going to share powerful stories of kidney patients, living donors, deceased donors, and industry experts. So the first episode will be, I will be interviewing a donor mom whose 20-year-old son was killed and saved several lives through organ donation, and his Grateful Heart recipient. It is a heart-touching story, and you don't want to miss it. The other programs that we have in date order, one other thing, we are participating with HRSA on a webinar to celebrate National Minority Donor Awareness Month, and that will be focusing on the Latinx community. That webinar will take place in English and in Spanish, two different webinars, but similar information. Let's start back. On September 10th, we have our Illinois Council on Renal Nutrition meeting for nutritionists. September 26th, we have kids living with kidney disease and transplantation. We have a program that starts on October 16th and goes for 8 weeks through December 18th, which is called Take Charge, the Chronic Disease Self-Management Program for CKD patients, dialysis patients, and transplant recipients. To do just that, encourage and teach them to take charge of their own health care. It's going to be an amazing program. This is the first time we've offered it, but it won't be the last. On October 19th, we'll have the Interdisciplinary Nephrology Conference for renal social workers, nurses, technicians, and nutritionists. November 2nd through November 21st will be our Living with Kidney Disease and Transplantation programs in English and Spanish. So those programs will take place over a couple of weeks' time. All of these, of course, are being done virtually. In February 18th, we're holding out hope to have a program in person, a professional program called the Citywide Grand Rounds for renal medical professionals. So for empowerment, we do advocacy. We advocate on a local, state, and federal level for policies that help improve the lives of those that are impacted by kidney disease, and for the hero living donors who give a piece of themselves to help others. We also have volunteer opportunities, because when people get involved and share their stories, they are often empowered to do more for themselves and feel better emotionally and mentally. And of course, we can't do any of this without funding, so we've got some great events coming up to fund the mission. So our virtual Walk for Kidneys is coming up on September 13th, and our gala will be October 29th. We are so sad that our walk can't be in person, because imagine 3,000 to 4,000 people coming together in honor of kidney disease to walk together and be together and have fun. But we promise that we're going to make the virtual walk just as fun. And let's face it, you'll save money on gas and parking. So as you can see, kidney disease doesn't stop during COVID, and neither do we. In fact, many people have had kidney failure as a result of COVID-19. Therefore, we're working that much harder to help make a difference. So thank you so much for this opportunity to share with you about kidney disease and NKFI today.
Thank you, Monica. I was made aware that we are having some technical difficulty with the slides. I want to remind everyone that we do have handouts, and in those handouts, we do have the presentation slides for you to view. So we apologize for any technical difficulty that we're having. Also a reminder, if you have any questions, to please type in the question box, and we will answer at the end of this presentation. And our last speaker for today is Tina Montgomery, and she is the Community Affairs Specialist at Gift of Hope, and she is going to tell you how you can get involved. Tina?
Thank you, Terry. Thank you, everybody, for being on today. So our guests, our experts, have given you kind of laid you the groundwork about what National Minority Donor Awareness Month is about, what does this health disparity look like, and then how do we get past that, and what is the educational opportunities. Well, with you having all that information, I'm here to talk about how you can help us move the message on. And there's 3 ways that you can help, and we'll have some additional ones at the end. One is partner with Gift of Hope. Similar to NKIF, we are looking to partner with community-based organizations to figure out a way that we can continue to share the message about donation and transplantation. Also, to help you understand more about and to get involved in the National Minority Donor Awareness Month campaign, we've created a comprehensive online toolkit at giftofhope.org that will provide you a walkthrough of all our campaign materials, and I'll touch on those just a little bit in the next slide. But I think lastly, you've had a great opportunity to hear both Jim and to hear Monica's story about transplantation. But on the other side of that, we have these phenomenal donor families that share their story. And so in honor of National Minority Donor Awareness Month, we have been able to take 8 of our families from donors and recipients and telling their stories. These are an opportunity for you to learn more about the selfless act of being an organ and tissue donor. So that's how you can help us. Now we made this so easy for you to really help us, to be honest with you. We've worked really hard at Gift of Hope to put together what we call a comprehensive toolkit. As you can see in that comprehensive toolkit, when you go to giftofhope.org, you will notice that in there is a host of just ready to drop, pre-made for you to go forward. You will see in your handouts today, we've given you an example of what our infographic is. In addition to that, we've also given you a copy of our toolkit. But if you are someone here from a hospital, a corporation, a community partnership, or even a faith-based organization, we have a specialized toolkit just for you as well that will house the same information and the same content that I'm sharing with you right now. So please go out to our website, take a look at the overview of what the campaign includes, and please utilize it as an opportunity to share and spread the word about the campaign. The last thing, there are a few things that you can do right now to really get started. One is, as we've told you before, we've already helped put together this comprehensive toolkit for you, so all the information is in there. Sometimes getting a message from your leadership of your organization really can push people to get involved and act. So we've already developed template language that can be sent out by your leadership. Also, learn about more heroes in your community. Monica and Jim are living heroes, but also it's an opportunity to have maybe one of our donor families or our transplant recipients to come to a community meeting or an event and tell their story and why it is so important that you do donation. Also, you can celebrate heroes in your community. Like our hospitals, they fly a flag over their hospitals when a family's made the selfless act of being a donor. You can do that same thing. Either one, by contacting myself, and I'll give you my information then, you can fly a flag, or figure out a way that we can put something from a poster that we have available in our office to put in your window to show that you support donation. Also, helping take the message forward. We really want to make sure you include information in your newsletters, your social media platforms, and a variety of different ways to continue to keep it upfront and personal for people about the importance of donation. And then lastly, host an education or a registration station. We have made this super easy for you. We have a new text feature called Text Commit to 5155. You can share that across all of your platforms, and people can register instantaneously there. That text option is also available in both Spanish and in English. So text commit to 51555. So this is how you get involved. I hope you all connect and check and reach out with us. We're going to have Carrie come on and talk through your questions. So please, would all of our speakers please turn on their cameras and turn their mics on?
Thank you, Tina. Thank you to all of our presenters today as we presented the Health Disparities webinar. We hope that you all enjoyed this conversation around minorities and donation in Central Illinois. Now is time for any questions that you may have. If you have not done so already, please type your questions in the questions area in the panel, on the panel on your screen, and our presenters will answer these for you. Our first question comes from Dr. Wilkins. He says, I really enjoy and appreciate the presentation. Will someone clarify the issue of wanting to be a donor but not wanting the designation status displayed on one's driver's license and why that may be? Anyone? Michelle, can you speak to this for us?
Yeah, so Carrie, can you clarify? Dr. Wilkins wants to know the status of why the donor designation, somebody would not want it to be on the driver's license?
Yes, that's the question reads as someone wanting to be a donor but not wanting the designation status displayed on their driver's license and why that may be.
Yeah, it's a great question. I actually have not come up as somebody who has an objection to that. So I can only kind of infer. I don't know if anybody else on the panel has had that come up with them. Maybe Monica's shaking her head, but so I'll defer to Monica if you have a good answer for that.
Yes, so in my years of doing outreach about organ donation, many people are afraid of putting the designation on their license because they feel like they won't be saved if it's a known fact that they are a donor. And so we answered that to say, for one thing, if you have an accident, the first responders are never looking for your purse. They're never looking for your driver's license. They go right to work saving you and they get you to the hospital, and every effort is exhausted to do that. However, some people, there is a major distrust in the system and with medical care especially within minorities. So in order to offset that, we encourage people who have that fear to have the conversations with their family and talk with their loved ones and express their wishes. If you wish to be a donor, the conversation is going to happen at the given time with if you are in a position to be a donor. Gift of Hope or the local OPO is going to come in and have a conversation with your family. At that time, if your family is aware of your wishes, whether you've designated or not, they are able to say yes on your behalf. So we make that clear and we express to people to please have those conversations, because that is the most important thing. Even when people are registered, if they don't make their families unaware, make their families aware of that, it can be a difficult situation when the time comes. I hope that answered the question.
Thank you, Monica.
I had never heard of that before.
Monica, go ahead, Jim.
I was going to say I'd never heard of that before, but obviously the downside is, God forbid you come to the hospital unconscious and your family can't be reached, and no one would know of your wishes. And that would be a real tragedy.
Thank you. Monica, this next question comes for you also. It says, thank you for your presentation. You spoke of advocacy. What messages are you sharing with legislators to support programs to support kidney disease prevention and donation and transplantation?
Sure, that's a great question. So I'll start with the federal level. On the federal level, we are currently advocating for a bill to extend Medicare's coverage of immunosuppressant medication. So currently, Medicare will pay for dialysis for a lifetime. There's no limit for the amount of years that Medicare will pay for dialysis, regardless of your age. So you don't have to be retirement age to be eligible for Medicare if you have end-stage renal disease. However, when you get a transplant, Medicare will pay for the transplant and they will pay for the medication for 3 years beyond that. And after 3 years, then you're on your own. You have to other insurance. So we are advocating that Medicare will extend that coverage because statistics show that the rate of rejection goes up after 3 years, because if people can't take their medication regularly, if they're unable to afford it, then they are likely to go into rejection and end up back on dialysis. So that's one of the things that we're legislating for on a federal level. On a state level, we legislated for living donor protection, and we were successful in getting that passed. And so that living donors are in Illinois can't be discriminated against based on the fact that they've given a kidney. So they're the healthiest people around if they're able to donate a kidney, and they should not be discriminated against from getting insurance or additional life insurance and things like that. We also we eventually hope to get some legislation passed that will support living donors when they take off time from work to be a donor. So those are some of the things that we've been working on advocacy-wise, and we encourage everyone to come work together with us. Contact me if you have some ideas of what we should legislate for. Let's do it.
Carrie, I would just add on to Monica too that Gift of Hope developed ITF, the Illinois Transplant Fund, and that helps pay premiums for those that are receiving insurance premiums for those that are receiving transplants. And there's certain income levels and certain criteria that has to be met. But I think that's just another way to advocate for those in need to be able to get their transplants. So that's Illinois Transplant Fund, ITF.
Thank you, ladies. And our next, it's not really a question, but a comment. It says, the fact that 61% of people waiting for a kidney transplant are African American and Latino needs to be communicated more often in Illinois to support the early detection of kidney disease. Thank you for a great webinar. That came from Kevin Fowler. So we do have another question though. Can someone speak to incorporating organ donation conversations into advanced care planning conversations that are promoted in primary care? Is this appropriate or should it remain a separate conversation?
Yeah. So
Terry, I was going to say, I would jump in on that too. From a community perspective, we have great staff that is working with the hospitals on a regular basis, and they're doing a phenomenal job. But I think also looking at some of those community-based clinics, health departments, and things of that nature, that we can begin having conversations started there. Signage, brochures, posters, or even long-term goal would be to have either a question or some information at intake. So I think that from a community perspective, we do see ourselves working with those community clinics that may not be in the hospital, but as an opportunity to engage with community members.
Michelle, did you want to add to that at all?
No, I think Tina answered it perfectly.
Thank you. One more question. Does my social or financial status play a role in whether I receive an organ if I need one?
No,
No
not
way.
at all.
No
way.
Is there ever a cost to be a donor or for the donor family?
No.
So no. So there is not a cost for that. Those are all. So when we work with hospitals for donation, those costs incurred for donation are then put to Gift of Hope. They're billed to Gift of Hope. They are not billed directly to the family. And so that is all kind of taken care of, I guess what I would say, behind the scenes.
Right. There's a couple more comments. One was from Dr. Wilkins again. He was just clarifying that he was wanting to make the point that you can be in the registry without having the designation on your driver's license.
Yes.
So that does happen sometimes too, that you maybe just renewed your driver's license and perhaps you didn't get an actual new physical license, but even though you said yes. So we always check that one of the first phone calls that is made, or not phone calls, but check that is made, is to check with the registries to see if there's any donation designation. And the other is from Dr. Wilkins again. Thanks, Monica. Great information to have when the opportunity comes to talk to legislators. Thank you. Legislators, thank you. If we don't have any more questions, I'll give it just a couple seconds in case there's a delay. Let's see. Anybody? Okay. So if that's all, then I just want to say thank you all again to all our presenters for sharing your expertise on today's topic. We here at Gift of Hope would like to thank our audience for attending this webinar. Again, your feedback is very important to us, so we ask that you please take a moment to complete the survey that will be sent to you, and we look forward to you attending any of our upcoming webinars. You can visit the Gift of Hope website for information on these upcoming webinars, and we will say please enjoy the rest of your afternoon, and thank you again for joining us.
Thank you.
Thank you.
Bye.